Hey guys, welcome to our post-operative video guide to dental surgery with or without regeneration. So in the first 24 hours, here's what you should expect. From a pain perspective, the amount of pain that you feel after the surgery has a lot to do with the difficulty and size of the surgery performed. The bigger the area involved, the more pain you're likely going to feel afterwards. If this pain significantly increases a few days, between 3 and 7, after surgery, please give our office a call to make sure that you don't have a post-op infection. Regarding bleeding, you are going to bleed for the first 24 hours after surgery. This is completely normal. Keep in mind that when blood mixes with saliva, it may appear as if you are bleeding more than you actually are. And don't sweat it if you're still bleeding a bit when you go to bed. Just put a towel over your pillow and get a little shut-eye. Regarding swelling, you are probably going to experience some degree of swelling after surgery. The amount of swelling that you have will depend on the difficulty and size of the surgery performed. The swelling is usually greatest in the first 4 days and should start to decrease by days 7 to 10. If swelling increases significantly a few days, again 3 to 7, after surgery, please give our office a call to make sure that you don't have a post-op infection. Regarding sutures, when sutures are placed after surgery, you might feel them with your tongue. Do your best to leave these little guys alone. Messing with them is ultimately going to decrease the probability you heal correctly. The time it takes for your sutures to dissolve has everything to do with the type of suture material used and how your body reacts to them. These sutures may start to come out anywhere between 2 days and 2 weeks after surgery. If non-dissolving or non-resolvable sutures were used, our office will need to remove them anywhere between 2 and 6 weeks after the day of your surgery. Let's talk about a couple no-can-dos. Number 1, do not rinse with anything for the first 24 hours after surgery. Number 2, do not spit, suck through a straw, or touch the surgical site. Don't even pull on your cheeks or lips to look at it for the first 7 days after surgery. Number 3, do not rub or apply excess pressure to your face to massage the area if bone grafting was performed. Remember, bone heals best when it doesn't move. Number 4, do not smoke or drink alcohol for the first 3 days after surgery, and please just quit smoking altogether. Number 5, do not exercise, mow the lawn, vacuum the house, or play sports for the first 5 days after surgery. These activities tend to increase the risk for bleeding. So at a bare minimum for the first 24 hours, you should be a couch potato. Number 6, do not eat or drink any hot foods or beverages. Warm is okay for the first 7 days after surgery. Remember, for the first 24 hours, it needs to be strictly cold. Number 7, do not consume spicy foods, chips, popcorn, carbonated drinks, or acidic juices like orange or grapefruit juice for the first 14 days after surgery. So what are some things that you can do to improve your healing? Pressure to start with. If gauze packs were placed in your mouth by one of our staff members, you should continue to keep these pads in place. Do not change them for the first hour, after which they can be gently removed. If active bleeding is still persisting, place enough new gauze to obtain pressure over the surgical site for another 30 minutes. This gauze can then be changed as necessary, and this is typically in intervals of 30 to 45 minutes. It is best to moisten the gauze first. Remember, you don't want it wet, but you certainly don't want it dry before reapplying them in your mouth. Cold packs. So as you leave the office and when you arrive home, use a cold pack on the outside of your face next to the site where the surgery was performed to keep the swelling down. Keep the cold pack on for 20 minutes and then off for 20 minutes. You can repeat this cycle for the first 36 hours after surgery. Regarding medications, take all the medications given or as prescribed as directed. You may have started some of them before the day of surgery. Take all these medications with food unless otherwise stated. The only exception to this is narcotic-type pain medications. If you choose not to take them, that is completely fine by us. For your oral hygiene, do not rinse your mouth for the first 24 hours. After this, you can start rinsing, and you can start brushing and flossing your teeth, but be careful to brushing and flossing around areas where the surgery was performed. If you're uncomfortable brushing or flossing, then just don't do it. This area will be fine for the next 2 weeks. Do not under any circumstances use a water pick or water flossing device, as they are traumatic to the healing process. Rinsing with the prescription mouthwash, Listerine, or warm salt water will help to clean the area that's been treated. To make a salt water rinse mixture, take 1 teaspoon of salt and mix it in half a glass of water. Make sure that it is warm but not hot. I caution you to not rinse vigorously. Instead, put the mouthwash in your mouth and then gently rock your hot head from side to side, bathing the surgical site in the mouthwash. For your diet, most patients find it's difficult to sit down and eat a normal meal after a dental surgery, and it's not difficult to see why, because chewing or chomping on the surgical site will aggravate it and probably result in pain. Worse yet, it could reopen the surgical site and result in an infection or healing complications. We suggest that you eat soft foods, take smaller bites, and chew only in areas where there was no surgery performed. Avoid highly seasoned foods or sharp foods such as nuts, popcorn, and potato chips. It's important to maintain a healthy, nutritious diet while you heal. Patients that do this generally heal faster and have less discomfort. For your multivitamins, it's great to have a balanced, healthy diet while you're healing, but all too often this is not enough. A lot of Americans walk around with vitamin deficiencies that they're completely unaware of, and this could potentially negatively affect how you heal after surgery. It is our recommendation that you make sure that you're on a high-quality multivitamin, and if it does not include vitamin D, add that as a supplement. For days 2 through 14, what should you expect now? From a pain perspective, quite often the second day is as bad, if not worse, than the first, but hang in there, you're going to get through this. Again, the amount of pain that you feel is directly associated with the difficulty of the surgery and the number of teeth involved in that surgery. Pain is usually worst for the first 3 days and should be gone by days 10 to 14. If pain and or swelling increases significantly a few days, between 3 and 7, after the surgery, please call our office for instructions. Regarding bleeding, you may still have a little bit of bleeding from the surgical site. This is mainly in the form of oozing, and its appearance should be pink because it's mixing with your saliva. If you still have heavy bleeding by the end of day 2, please give our office a call and we'll take care of it. Regarding swelling, you may experience additional swelling from what you saw in the first 24 hours. The swelling may continue to get worse by the end of the second day, but it should level off by day 3 and begin to get better by day 4 and 5. Again, the amount of swelling will be directly associated with the difficulty of the surgery and number of teeth involved. If this swelling significantly increases a few days, between 3 and 7 after surgery, please give our office a call to make sure that you don't have a post-op infection. Regarding bruising, the development of a black, blue-green, or even yellow discoloration on the outside of your face is the result of blood spreading underneath your tissues. Now, it's quite normal for a bruise to form in the first 2 to 3 days after surgery. The size and length of time that you had this bruise will be directly related to the size and complexity of the procedure. Most bruises go away in 7 days, however, some may persist for up to 14 days after surgery. So what are some things that you should be doing at this point in time? So, for warm packs. After the first 24 to 36 hours, the cold packs can be switched now to warm packs, although this is not required. Gentle pressure is all you need, just make sure that it's not hot. Your diet for the first 24 hours will be a little bit different from after 24 hours. The first 24 hours, everything needs to be cold. After that, it can be switched to warm. Now, as a rule of thumb, if you can't easily pinch through it, you probably shouldn't be eating it. We suggest that you continue to eat soft foods, taking smaller bites and chewing only on areas where surgery was not performed. Continue taking your multivitamin supplement as well. Make sure that if it does not have vitamin D in it, add that. So for days 15 and on, what should you be expecting at this point in time? Regarding pain and swelling, you should no longer be experiencing any major pain by the 3rd week of healing. If you do feel an increase in pain or swelling at this point in time, please give our office a call and we'll make sure that you do not have a post-op infection. Regarding your sutures, if resorbable sutures were used, they will probably be dissolved by now. If not, we'll take them out. If non-resorbable sutures were used, they will likely be removed at your 2-week post-operative appointment. Sometimes we leave them in longer and we'll let you know if that's the case. If you feel a suture might still be present after the sutures were supposed to be removed, please give our office a call to make sure that we have not left one. Sensitivity. So, expect to have some pretty serious sensitivity after periodontal surgery was performed. Remember, the goal is to reduce the pocket depths and therefore gum tissue, and sometimes bone are removed in order to achieve these shallower pockets. This will result in exposure of the root surfaces that were previously covered by your gums. This sensitivity will continue to improve with time, although sometimes it takes months. Hang in there, I promise you it's going to get better. Things to avoid. Continue to avoid using a water pick close to the surgical site for the first month after surgery. Continue to avoid rubbing or applying excess pressure to your face to massage areas if bone grafting was performed. Remember, bone grafts heal best when they're not moving. Okay, at this point in time, what are some things that you should be doing? So by the time you're in your second week of healing, you should be feeling pretty close to your old self and hopefully better. Discontinue using the oral mouthwash at this point in time. Continue taking caution, brushing and flossing around the surgical site, but don't be afraid to make sure that things are clean. It is our recommendation that at 2 weeks you resume normal hygiene when it comes to periodontal surgery. For your diet, if your surgery was performed without bone grafting or the placement of any regenerative materials, you are free to pretty much eat whatever you want. However, it's always a good idea to continue to take smaller bites and chew only on the opposite sides where surgery was performed if you're still sore. If surgery was performed on both sides, continue following the soft food diets we recommended for days 2 through 14. Remember, vitamin supplementation is important, so continue taking your multivitamin supplementation. If it doesn't have vitamin D, please add that in. So what's next? You will have more than likely a 2-month re-evaluation appointment at our office. So approximately 2 months after your surgery was performed, we'll need to evaluate your teeth at our office. At this appointment, you will have your teeth thoroughly cleaned and your gums will be re-evaluated. We want to make sure that the pocket depth reduction was successful. Sometimes we do a 6-month re-evaluation, and this is the case if bone grafting or regeneration was performed. These specific teeth must remain undisturbed for at least 6 months. It takes time for the bone around the teeth to mature. We will send a letter to your referring dentist explaining where the graft was performed and specific instructions on when it's appropriate to reprobe the gingival tissues. It's not over yet. Now you've entered periodontal maintenance. So it's important for you to understand that periodontal surgery alone is just the beginning. Unfortunately, periodontal disease cannot be cured, just slowed down or hopefully halted completely. Therefore, once your surgery is complete, it's your job to make sure that you maintain the results that we achieved. And the best way to do this is through thorough, excellent oral hygiene and diligent routine periodontal maintenance appointments at our office and your general dentist's office. These appointments should be scheduled every 3 months for at least the first year after your periodontal surgery. Let's talk about your oral hygiene. So the following is a list of things you can do to reduce your risk of periodontal disease returning. Number 1, brush your teeth twice a day for 2 minutes at a time. Make sure you are not just brushing the crowns or tops of your teeth, but you're also brushing along the gum line. Remember that bacteria that infect your teeth will sneak under the gaps between your teeth and your gums, and if they get too deep, you will no longer be able to keep them out of there. And then unfortunately, you'll be back for more of this. So let's maintain those results. Number 2, floss your teeth at least once per day, and mouthwash is not necessarily a bad idea either. Number 3, see your dentist or your periodontist every 3 months for routine periodontal maintenance cleaning at least the first year after your procedure. Okay, so let's talk about ways you can eliminate risk factors as well. So you've just made a financial investment towards saving your teeth. Therefore, you probably want to protect your investment by reducing or eliminating anything that may put your teeth in jeopardy. The following is a list of risk factors that have been shown to be associated with increased risk of tooth loss and worsening of periodontal disease. First and foremost, smoking. It's a terrible thing for your gums, and it's a terrible thing for worsening periodontal disease. And this includes cigarettes, cigars, pipes, marijuana, and vaporizers. Number 2, poorly controlled diabetes. This includes type 1 and type 2. Number 3, cardiovascular diseases. High blood pressure, strokes, aneurysms, atherosclerosis, all of this is included as risk factors for persistent periodontal disease. Okay, so that sums up everything for this post-operative video. Hopefully you found it informative. I wish you smooth and excellent healing results after your procedure, and we will see you at your post-op.